Hello friends, welcome you all at Indian Institute of Learning Life-Saving Skills. Today we'll be discussing most important topic on clinical rounds, and the topic being intestinal obstruction. Intestinal obstruction. So intestinal obstruction, कैसे पता चलता है हमें पेशेंट को intestinal obstruction होगी? The first thing is the patient comes with what?
Persisting vomiting,
No, first
abdominal pain.
First will constipation, followed by bloating. Okay.
Hello.
Then there is a
Distension.
flatus. Bloating and distension both are same. Okay. So there will be history of constipation. There will be bloating and flatus. Patient will not pass. Here patient either will be passing stools, completely not passing, or will be partially or less passing. Okay. So bloating and flatus will not be passed. So here two terms. One is constipation. When this proceed to patient is not passing flatus, we called it as obstipation. What?
Obstipation.
Let us say once more.
Obstipation.
So partial, when the patient is passing flatus and not passing stool, we called it as constipation. Obstipation, when patient is not passing stool and flatus, is called as obstipation. This is called as complete gut obstruction. Complete gut obstruction. Then you have to see whether obstruction is acute or chronic. What? Acute or chronic. If patient gives a history of more than a week, 10 days, 15 days, then it is a chronic constipation, or more than 15 days, sometimes passing stool, sometimes not passing. Okay. If patient gives sudden history like within 24 hours or less than 24 hours, there is a obstipation. So it comes what?
Obstipation.
Complete obstruction, and it is acute. Okay. Then another classification is partial or complete. In partial, person will be passing stools in less quantity. In complete obstruction, not passing. Okay. Then infective, non-infective. The cause might be infective or non-infective. We have to look at, like infective cause there might be MTB, okay, miliary tuberculosis, what you said as Cox, otherwise calling. Okay. Non-infective means due to some
Trauma, additions.
definitely
surgery.
trauma, additions, surgery. Okay. And there might be something called as, sometimes patient will inhale hairs. Have you heard of trichobazar? No. Trichobazar is a term where patient will be engulfing small hairs, and it will obstruct the complete intestine. You can Google this word, trichobazar. Okay.
इसका
Tricho means hair, bazar means गांठ. उसका पूरा गुच्छा मिलेगा आपको.
इसका आयुर्वेद में वर्णन है.
Trichobazar, hair. Okay. MTB, Cox. These patient will be usually psychiatric patient. they तोड़ेंगे, बाल को खाएंगे, और वो इकट्ठा होके वो पैथोलॉजी कर सकता है. ओके. देन नॉन इन्फेक्टिव माइट बी वॉर्म्स. व्हाट? Worms, trichuriasis, okay, ascariasis, these kind of things. So acute on chronic, partial, complete, okay, infective, non-infective. Then another classification is small gut and large gut. Whenever there is a large gut obstruction, the symptoms will come very late. See, this is the reason. This is the reason. So if it is a large gut, though this all small intestine will fill completely, then there will be symptoms. So there will be more constipation. If there is a large gut problem. If there is a small gut, suppose there is a problem at the pylorus, the symptom of the patient will be what? Vomiting. What? Vomiting. Immediately patient will be start vomiting. So if patient comes with more of vomiting, then you have to look for what? Small gut obstruction. If patient will come more of constipation, bloating, distension, then you have to look for what? Large gut obstruction. So this is how you have to evaluate the patient. If patient is very thin and you can see the abdomen and you can see the gut sounds, like on you are doing percussion, so there will be resonant, hyper resonant, or there will be tympanic. more tympanic. So these patients will be coming under what? Complete gut obstruction. So this is how clinically you have to evaluate the patient. And sometimes there is a something called as, have you heard of this one? One more term I will tell you. Paralytic ileus. What? Paralytic ileus. Okay. Sometimes in post-operative cases and all, there will be, after spinal anesthesia, GA anesthesia patients, what happens? There will be obstruction. So that time you have to get rid of one sodium and potassium of the patient. So this is how you have to evaluate the patient. When the patient comes clinically with the pain abdomen, distension. So if small gut obstruction means coming content from upside, if large gut obstruction, content won't be passing through that. So constipation will be more symptoms. So this is how you have to evaluate the patient. So simple thing you can get it done is, first is your clinical examination, history of the patient. Third thing is, if ultrasound not available, get it done erect abdomen X-ray. So in that you will find hair string pattern or multiple patterns you will find. If ultrasound available, you can get it done the ultrasound. Okay, if patient is vomiting more, there will be distension, then we have to do what? Gastric. So that what we call that? गैस्ट्रिक कंप्रेशन. गैस्ट्रिक को हम कंप्रेस करेंगे, राइल्स ट्यूब डालेंगे और सारे कंटेंट्स को बाहर निकाल देंगे. अगर ऑब्स्ट्रक्शन माइल्ड है तो अपने आप रिलीव हो जाती है, नो नीड ऑफ सर्जरी. इफ देर इज ए मोर प्रॉब्लम, समटाइम्स विल गो फॉर कॉन्ट्रास्ट CT एंड ऑल. इफ देर इज ए मोर ऑब्स्ट्रक्शन, समटाइम्स हैव टू गो फॉर सर्जिकली. सो थैंक यू वेरी मच. कीप कनेक्टेड विद इंडियन इंस्टीट्यूट ऑफ लर्निंग लाइफ सेविंग स्किल्स फॉर दिस डेली क्लिनिकल राउंड्स. थैंक यू.